Did you know that stroke is the leading cause of disability and the fifth leading cause of death in the United States? A stroke is a leading cause of death and disability worldwide. In the United States, someone has a stroke every 40 seconds. Every year, more than 795,000 people have a stroke, and about 137,000 people die from stroke. According to WHO, annually, 15 million people worldwide suffer a stroke. Of these, 5 million die and another 5 million are left permanently disabled, placing a burden on family and community. Stroke is uncommon in people under 40 years. When it does occur, the main cause is high blood pressure. The good news is that many strokes can be prevented. By knowing the warning signs of stroke, you can take quick action to get the medical help you need and reduce your risk of serious damage. Pay close attention because recognizing these signs early can be a real lifesaver. Before we kick things off, if you're new here, make sure to hit that subscribe button and ring the notification bell. Now, let's begin with the basics. A stroke is a medical emergency that occurs when the blood supply to part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. This can occur due to a blood clot or a burst blood vessel. There are two main causes of stroke: a blocked artery, known as ischemic stroke, or leaking or bursting of a blood vessel, known as hemorrhagic stroke. Some people may have only a temporary disruption of blood flow to the brain, known as a transient ischemic attack, TIA, that doesn't cause lasting symptoms. Ischemic stroke is the most common type of stroke. It happens when the brain's blood vessels become narrowed or blocked, causing severely reduced blood flow, ischemia. Blocked or narrowed blood vessels are caused by fatty deposits that build up in blood vessels or by blood clots or other debris that travel through the bloodstream, most often from the heart, and lodge in the blood vessels in the brain. Hemorrhagic stroke occurs when a blood vessel in the brain leaks or ruptures. Brain hemorrhages can result from many conditions that affect the blood vessels. A transient ischemic attack, TIA, sometimes known as a ministroke, is a temporary period of symptoms similar to those in a stroke. A TIA doesn't cause permanent damage. Like an ischemic stroke, a TIA occurs when a clot or debris reduces or blocks blood flow to part of the nervous system. If you or someone you're with may be having a stroke, pay particular attention to the time the symptoms began. Here are 9 warning signs of stroke that you need to check 1 month before of a stroke. So, let's start with the first warning sign: sudden, severe headaches. Right, severe headaches can be a major red flag. They often happen when a blood vessel bursts in the brain, which is called a hemorrhagic stroke, or when a blood clot disrupts blood flow, known as an ischemic stroke. A sudden and severe headache with no known cause can be a warning sign of stroke. This is because a stroke can cause bleeding or swelling in the brain, which can lead to a headache. A study published in the journal, Stroke, found that severe headaches often precede strokes, especially in women. And here's the important part: preventing high blood pressure is key here. It's a major risk factor for stroke, so things like a healthy diet, regular exercise, and, if needed, medication can make a huge difference. Next up, we've got vision problems. These can occur when the blood vessels in your eyes get damaged due to a stroke. It's why keeping your blood pressure and cholesterol levels in check is crucial. Sudden vision loss or changes in vision in one or both eyes, such as blurred vision, double vision, or seeing black spots or flashes of light, can be a warning sign of stroke. It may be an early indication of an impending stroke. The New England Journal of Medicine published research showing that visual disturbances are a common early sign of stroke. Moving on to trouble speaking. Stroke can affect the brain regions responsible for language. Difficulty in speaking or understanding simple words or slurred speech can be an indication that a stroke is imminent. Pay attention to such changes and seek medical attention promptly. So, if you or someone you know is struggling to speak or understand language, take it seriously. According to a study in the journal, Stroke, difficulty in speaking or understanding language is a prominent warning sign. Now, let's talk about numbness or weakness. Numbness or weakness can be a sign that blood supply to certain brain regions has been disrupted. Sudden weakness or numbness in the face, arm, or leg, especially on one side of the body, can be a warning sign of stroke. This is because a stroke can damage the part of the brain that controls movement. Multiple studies, including one in the Journal of the American Heart Association, have confirmed the link between numbness and strokes. Experiencing sudden and severe pain in your arm or leg, on one side of your body also could be a significant warning sign of an approaching stroke. Seek immediate medical attention. Next on our list is balance and coordination problems. These can happen when stroke affects the brain regions that control these functions. If you find it difficult to walk straight or maintain your balance, it's crucial to take note. Unexplained dizziness or difficulties with coordination may be a warning sign of stroke. These issues may arise when specific brain regions that control balance and coordination are impacted by stroke. Regular physical activity, like walking or yoga, can improve balance and coordination. And don't forget about severe fatigue. It might not seem like a big deal, but excessive fatigue can result from brain changes due to reduced blood flow. Sometimes, feeling extremely tired, even after a good night's sleep, can be a sign your body is sending you about an upcoming stroke. A study in the European Journal of Neurology highlights that excessive fatigue can be an early symptom. Managing stress and getting enough sleep are crucial. If you're experiencing sudden shortness of breath or struggling to breathe, it's essential to consider that it might be a symptom of an impending stroke. Don't ignore it. Facial drooping, that's one of the more recognizable signs. It occurs when stroke affects the nerves controlling facial muscles. Facial drooping, especially on one side, can be a visible sign of an impending stroke. The Journal of Neurology, Neurosurgery and Psychiatry has published research emphasizing facial drooping as a stroke precursor. Now, emotional changes. Mood swings, unexplained bouts of depression, or sudden emotional shifts can be your body's way of warning you about an impending stroke. Sudden changes in mood or behavior, such as becoming irritable or confused, can be a warning sign of stroke. This is because a stroke can damage the part of the brain that controls emotions. That's why managing stress through relaxation techniques and exercise is so important. And finally, we have nausea and vomiting. Nausea and vomiting can occur when the brain's control centers for these functions are impacted. When stroke impacts the brain's control centers for these functions, these symptoms can occur. So, there you have it, 9 warning signs of a stroke that your body might reveal to you a month before it happens. Here are some tips for preventing stroke. Generally, adopting a healthy lifestyle is key. Controlling high blood pressure stands as one of the most critical actions you can take to minimize your stroke risk. Lowering your cholesterol and saturated fat intake is another vital step. By reducing the consumption of cholesterol, fats, especially saturated and trans fats, you can potentially diminish arterial plaque buildup. Quitting smoking is a powerful stroke prevention measure. Smoking elevates the risk of stroke not only for smokers but also for non-smokers exposed to second-hand smoke. Maintaining a healthy weight is vital since excess weight contributes to other stroke risk factors like high blood pressure, cardiovascular disease, and diabetes. Engaging in regular aerobic exercise can substantially reduce your risk of stroke. Exercise helps lower blood pressure, boost levels of good cholesterol, enhance the health of your blood vessels and heart, aid weight loss, control diabetes, and alleviate stress. If you choose to consume alcohol, moderation is key. Excessive alcohol intake increases the risk of high blood pressure, ischemic strokes, and hemorrhagic strokes. It may also interact with other medications you're taking. Consult your healthcare provider to determine what's suitable for your situation. Illicit substances like cocaine and methamphetamine are well-established risk factors for TIAs and strokes. Staying clear of these drugs is essential for your overall health and stroke prevention. Remember, your health is your greatest asset, so invest in it wisely. If you have any questions or concerns about stroke, talk to your doctor. Thanks for joining us, and until next time, take care.